This presentation, Providing the Right Balance, a holistic approach to developing safe health ITC solutions, built upon several years' study of health informatics, both academic studies and real-world industrial problems. I come from a safety-critical background where ICT systems that fail will cause harm to the person, either injury or death. For example, jet aircraft computerized control systems. The aim with safety-critical systems is to minimize any risk of harm to acceptable levels or as low as possible. As with all computing systems, design is a compromise. Performance versus reliability, security versus accessibility, knowledge versus privacy, to name a few. The software and requirements engineers have to strike a balance. For health systems, that balance is mainly ensuring improved health outcomes within acceptable safety parameters. Since we have to provide the right balance, I would argue it is necessary to consider all the competing factors, hence the need to take a holistic approach. The topics I wish to cover include the characteristics of health information systems, why they are challenging, what makes them different. I'll review the recent changes in the Australian legal framework, particularly the demands for acceptable privacy. The privacy law has a new change coming into force, the need to notify when your security has been breached. And this leads to how we can take a more holistic view of privacy, where safety is at the centre. As a case study, I'll review how privacy is handled in the government's My Health record that is now being rolled out across the country. And finally, I'll discuss the way forward to ensure adequate privacy protection. So what makes health informatics challenging when compared to other ICT applications, such as financial services? Is it a complexity issue? A lack of qualified staff? Higher demands and expectations? Or the fact that medical errors can seriously hurt people? Well, yes, 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 and yes. It's all of these things and more. But to put it into context, I have listed what I believe to be the key differences. A list of 10 features that together make health information systems stand out as being different challenges to other vertical market industries. Number 1 is you're often required to service a whole population, include the elderly, the young, the abled, the disabled, the healthy and the sick. This might apply to an area, a state or country population. For the government's My Health record, it will cover anyone who's ever used Medicare or had a PBS prescription, i.e. almost everyone except some private-only customers. So that'll be reaching 25 million people soon, from cradle to grave. By comparison, other services may only apply to certain age groups. For example, issues of parental consent that may apply in healthcare when somebody turns 16 does not apply to driving licenses. Number 2 is the fact that healthcare to date has a lower percentage spend on ICT compared with many other services. This is improving, but it's still in catch-up mode. I mean, consider Australia's GDP at $1.6 trillion. Now, healthcare spending is above 10%, approximately 160 billion. The My Health record is being supported with an annual spend of 375 million, which sounds a lot, but equates to 0.3% of federal health spend on health. To make a comparison with other industries, consider education and training across all levels. Compare with health and social services in total. Deloitte claims there are under 3,000 ICT technical staff working in healthcare, with over 6,000 ICT managers. Compared to education, with only half the GDP spend, has more than twice as many technical ICT staff. Number 3, healthcare has a number of specific legislations to comply with. The next slide shows the main legislative acts and the complexity of enforcement depending on if your service is public, private, state or federal. And this is compounded by the fact that some small industries and some universities are exempt from major legislation of the Privacy Act. We have the Commonwealth, we have medium and large business entities, small business entities, a number of state and territory governments. The Privacy Act only covers partially. Each state may or may not have its own Privacy Act. There are a number of other acts relating to health to be considered. Then we have to look at IT companies, which are small businesses but not healthcare related, being exempt. And we have to consider universities, where some are in and some are out. So this is a complex patchwork, but really quite a pig to deal with. Number 4, often healthcare specialists and their patients have little choice in the applications that are available for critical services. For example, the MyGov application covers a range of services as a single portal. This includes access to My Health Record. For most people, they have no choice of applications to access this. Of course, this may change over time. Number 5, healthcare ICT have a broad range of users with a very broad range of expectations. It's very challenging to strike the right balance here. I guess the best example is My Health Record. Then number 6 is different budget drivers. In healthcare, there are many different budget drivers. This occurs in other sectors like education, but understanding the specifics for healthcare is vital to ensure any project will simply get off the ground. Then number 7, healthcare systems have often evolved bottom up, and there are many standards used across the sector, making interoperability very challenging. Number 8, things are only partially digitized. Unlike many other industries, there is still significant paper in use. Some are yet to digitize, and those that have still rely on legacy paper-based records that may never get digitized. Some recent stats on My Health Record: take-up is now trailing instead of opt-out instead of opt-in. We've still got a long way to go. So even at 17,000 new records being created each week, it would take 33 years to reach the rest of the 25 million population. Number 9, privacy and security demands. They're much higher when dealing with highly sensitive information. Breaches can cause not just embarrassment, but real harm to some individuals who have every right not to share outside the professionals involved. Now, the Privacy Act recognises this and expects a much higher levels of protection for sensitive information. And number 10, finally, the issues of safety and quality. People's lives are at risk. We need to ensure the risks have been minimised to acceptable levels. When it comes to look at the holistic approach, I will show how safety is the key to determining what privacy and security protections need to be in place. We know that security breaches, for example, can cause harm to an IT system in terms of the integrity of the data. It might result in change or deletion. It might slow down the system or cause a total denial of service. Before we look at the holistic approach, let's just consider the privacy law changes that have recently come about. Now, the new laws, we have the changes to the Privacy Act, a major update in 2014. We've got the My Health Record, originally the Personally Controlled Electronic Health Act, and we've got the Health Identifiers Act. And don't forget Spam Act and Do Not Call Register Act and the Freedom of Information Act, which may also apply. The most recent change that will come into effect is this Notifiable Data Breaches Scheme. The Notifiable Data Breaches Scheme will mandate that any serious data breach must be reported and urgent action taken to minimise the damage and inform those affected. Entities covered by the Privacy Act will need to complete a data breach notification form. The government assess the breach and advise accordingly. Of course, failure to comply will bring hefty fines, up to $360,000 for individuals and $1.8 million for organisations. There's a number of steps to take. I will not go through these now, but quickly I'll show you the guidelines that are available on the OAIC website. General guidelines dated 2014 are currently being updated. How to identify an eligible breach. How to access a breach. How to notify individuals who may be affected. How to develop a data breach response plan. And finally, which entities does this law apply to? As we can see from the legislation, good security is one of the requirements for privacy protection. But what else should we consider? To take the holistic view, we should include other components like confidentiality and trust. Each of these interdependencies, shown as connecting arrows, allow the right questions to be asked. For example, the relationship between privacy and safety is the need to protect individuals. From each of these connections, the label, for example, protect individuals, raises a general question. Are the measures in place adequate to minimize harm that could result from identifying individuals and disclosing their personal information? We can expand this to all the relationships and produce a set of 10 pertinent questions that help to consider the whole picture. Each of these can be drilled down further until we have a complete mapping. For example, can any clinician see a patient's confidential data, even if that individual is not part of their caseload? What protection have been put in place to protect from this? Well, let's see how well that's been done with My Health Record. So, this is my Health Record. There's a shared health summary. Now, I had to ask for this to be added. When I went to Fiji, so I ensured that there was a bona fide statement to show health professionals over there if necessary. Originally, My Health Record was called the Personally Controlled Electronic Health Record, PCEHR. A bit of a mouthful for the general public, of course. But the essence was that I can personally control this record. Now let's consider how that works in practice. Firstly, under my profile, I can find the 16-digit individual health identifier that I have been assigned. This is not actually it. I keep that one private, of course. I can set documents to be restrictive, or I can remove documents. Now, of course, this won't be recommended by healthcare professionals who really want to see everything about you. But I might want to restrict some information for the specialist only. For example, something the locum, who might just happen to be my ex-partner, I don't want them to see it, for example. Here's an example of one record that has been restricted for demonstration purposes. In this case, it was just a nasal spray. So you can set general access, restricted access via PIN, and remove a record altogether. Now you'll get plenty of warnings if you attempt to do this. I can set my email or mobile to be informed when the record has been accessed. In this case, for the first time, a new doctor or a practice has accessed my record. I have the ability to check the access history. Here is a list of who's accessed it and what action they've taken. In summary, you may control which healthcare providers can access your e-health record. If you wish to specify access, you should create a record access code. This code will need to be provided to those healthcare providers for them to view. Even if you have a record access code, all information in your record will be available in a medical emergency. For emergency access, they must be declared there's a serious threat to your life or health and safety. If you healthcare provider can access your record. So finally, Number 1, ensure your organisation is privacy compliant. To do this, take a holistic view on privacy and consider all the attributes. Do a privacy impact assessment, particularly with all new projects. Follow a privacy by design approach. Don't consider privacy after the design as an add-on. Report breaches and act promptly to prevent them reoccurring. I stated this years ago, but now it's become a legal requirement, mandatory. Don't sign up to any social networks without checking what you're committing to. Don't give out personal information you don't need to or want to. Take control of your personal information whenever possible. So, if further information on this, there are some free guidelines available on the website helpmeprivacy.com. For example, how to do a privacy impact assessment, how to assess cloud risk if you're thinking of using that for healthcare information. Please feel free to contact me if you have any further questions. I hope you found this informative. Thank you very much.